In many parts of the world, certain topics remain silenced, hidden behind layers of tradition, shame, and fear. However, here in the heart of rural Ethiopia, a new initiative is breaking down these walls. Welcome to the SAFA project, implemented by DSW Ethiopia, positioned at the forefront of addressing these issues to empower young people and communities nationwide, paving the way for a brighter future. The German Foundation for World Population DSW is an international organization founded in 1991 in Hanover, Germany. With its country office in Ethiopia, officially established in 2000, it has been working to improve lives through sexual and reproductive health, economic empowerment, and gender equality. DSW Ethiopia has been active for nearly 25 years. It has introduced innovative strategies to empower and enhance the SRH well-being of adolescents, youth, and women.
It is a German-based international development organization, mainly focusing primarily on adolescents and the youth. DSW empowers young people to demand and access information and services. DSW also empowers young people really to advocate for the rights of adolescents and the youth, mainly for the vulnerable adolescents and youth girls as well.
The SAFA project in Ethiopia is funded by Stiftung Allianz für Afrika in collaboration with the German Federal Ministry for Economic Cooperation and Development. A network of partnerships exists between DSW, HRNS, and the Elias Malaka Foundation EMF, aiming to empower youth aged 15 to 29 by addressing critical challenges in education, employment, and health. The project targets over 70,000 young people across the Amhara region, specifically in the West Gojam zone, Jabi, Tena, and Semen Mecha districts, and the Buno Badele zone of the Oromia region, Gachi and Badele districts. The initiative blends improved youth access to SRH information and friendly services, enhanced livelihood through innovative agricultural approach, and vocational training to improved supply chain management. It creates inclusive environments that foster gender equality and address harmful practices while enhancing livelihoods and leadership capacities.
SAFA is a joint program between different foundations, and it has three key components. One is a livelihood aspect, which is managed by Neumann Foundation. The other one is the logistic aspect, which is really mainly implemented by Elias Malaka Foundation and supported by Kune Foundation. And the DSW is implementing the sexual reproductive health aspect of SAFA program.
Through the SAFA project, DSW Ethiopia strives to transform knowledge and attitudes on SRH using innovative and impactful approach. One key method involves home-to-home interventions conducted by 360 female change agents who trained to engage married female adolescents and promote positive behavioral change.
My name is Alima Furisa. I am 20 years old. We recently completed a training given by DSW on family planning. Afterwards, we returned to our community to share our knowledge with women about short, medium, and long-term family planning. Our goal is to empower women to plan their daily lives effectively while protecting their children. We covered various topics, including sexually transmitted disease. We also addressed the specific need of women suffering from fistula. Although such cases were relatively rare, we had multiple visits to persuade these women to seek medical attentions. We also involved their husbands to encourage their support and understanding. We're pleased to see positive change among those who have sought medical help. We believe that with continued efforts, we can make a significant impact. I want to express my gratitude to the institutions, DSW, for providing us with valuable training on family planning and other important issues. I urge women in our community to embrace our guidance so we can work together to achieve our goals.
Another approach is young people who form youth clubs by themselves at their respective qabalés or villages, voluntarily joined and participated on different capacity building trainings. SRH peer education, as well as fostering open dialogue and spreading awareness within their communities. The initiative has significantly improved sexual and reproductive health SRH knowledge, livelihoods, life skills, and decision making by providing comprehensive information and services to both married and unmarried youth, empowering them to make informed decisions on SRH and other culturally untouchable issues.
From the fertile ground of DSW training in Bishoftu, a vibrant youth club blossomed. What began as a small seed of 20 eager young hearts, nurtured by our shared passion, has grown into a flourishing tree, its branches now sheltering 40 souls. Since that auspicious beginning, we have diligently cultivated a garden of life skills tending to the delicate blossoms of sexual and reproductive health and other vital knowledge. Our hands, guided by compassion, has extended beyond the club's walls, engaging in the countless acts of selfless charity. We have toiled alongside our neighbors, lending our strength to infrastructure projects, mending roads and restoring homes, transforming the landscape with our collective efforts. This region thrives under the twin suns of two SAFA projects powered by the unwavering support of DSW and HRNS. Under the benevolent guidance of DSW, we have illuminated the minds of our youth, imparting invaluable lessons in life skills and sexual reproductive health, empowering them to safeguard their well-being. A rich tapestry of open dialogue has been woven through our peer teaching platform, where inspiring stories and experiences are shared, enriching the lives of all. Meanwhile, the generous hands of HRNS has bestowed upon us the transformative knowledge of agriculture, teaching us the secrets of irrigation, crop production, and the gentle art of beekeeping. The peer-led program, a beacon of hope facilitated by DSW through SAFA, has further empowered our youth, equipping them with a diverse array of life skills. As a result of the shadow of addiction has begun to recede, replaced by the radiant light of positive change. My own journey has been profoundly altered. The DSW training unveiled a world of knowledge, skills, and attitudes previously unknown to me. A transformation as breathtaking as the Ethiopian landscape itself.
The Creating Enabling Environments initiative, part of the SAFA project, fosters open and honest discussion on sexual and reproductive health and gender-based violence in schools. Through the Parent-Teacher-Students PTS platform, this initiative brings together parents, teachers, and students, creating a safe space where no issue is left unaddressed. It allows all parties to share knowledge, ask questions, and find solutions. The initiative empowers parents to engage in meaningful conversations with their children, helps teachers address these topics confidently, students to advocate for their own health and rights. Its impact extends beyond the classroom. These discussions spill over into homes and communities, building a culture of trust and support that helps protect young people and challenge harmful traditions.
Salamite Fatana, the guiding light of both the Wayisa Gota School Club and the School's Girls Club, eliminates a stark reality: the shameful silence surrounding reproductive health, particularly amongst high school students in Ethiopia. This deafening hush leaves young lives adrift in a sea of unanswered questions and unmet needs. Yet, a beacon of hope shines through the darkness. The Wayisa Gota Club, a testament to the power of youth-led initiative, has bravely stepped forward, significantly mitigating these critical issues over the past 2 years. Salamite eloquently describes the blossoming impact of the DSW project implemented through SAFA in the Oromia region's Getchi and Badale zone. a radiant light of awareness has been cast upon sexual and reproductive health, SRH, gender-based violence, GBV, and a harmful traditional practice yielding remarkable progress.
ለሴት ልጅ ራሱ መልካም እናት እንደሆን ያደረገኝ እሱ ነው።
ድሮ ጊዜ ወንዶችንም ስናይ የሴት ልጅ ወር አበባ መጥቶባት ክላስ ውስጥ ቢያዩ እንኳን ይስቁባት ነበር።
The crimson tide of womanhood, a natural and sacred right, too often washes ashore in classrooms where young women are not met with compassion but with a cruel tide of mockery and scorn from their male classmates. These boys, tragically blind to the biological miracle unfolding before them, respond with heartless ridicule instead of understanding. In stark contrast, the DSW program, particularly its PTS initiative, has blossomed as a haven of open communication, fostering a bridge of understanding between students and parents, especially on the most delicate of subjects. Before embracing the transformative power of DSW, many young people found themselves silenced by insecurity, their voices choked by self-doubt. Yet through the program's nurturing embrace, they have blossomed, their communication skills sharpened to a keen edge, their self-assurance fortified into an unwavering strength. My own journey mirrors this metamorphosis. Once paralyzed by fear, I now stand empowered, my voice a clarion call for change. The training liberated me, teaching me to communicate with persuasive eloquence and unshakable confidence. Shyness has vanished, replaced by a bold spirit that dares to challenge harmful traditions and inspire others to do the same. This newfound courage cultivates a healthier cultural landscape, one that embraces the virtuous while rejecting the pernicious. Through DSW, I have embarked on a journey of profound self-discovery, forging a deeper connection with my fellow students. My voice, once a whisper, now rings with clarity and strength. To all young women, I offer this message. Know your inherent worth, embrace humility, and let your heart guide you with kindness and compassion.
ሴት ተማሪዎች ምንም ነገር ማድረግ ትችላላችሁ እና ልባም ሴት ሁኑ ማለት ፈልጋለሁ።
By empowering individuals and strengthening institutions, the SAFA project ensures sustainable solutions to the sexual and reproductive health SRH services and information challenges faced by many Ethiopian youth. Capacity building under the SAFA project begins with strengthening youth club and youth empowerment centers, health facilities, and other public sectors. Gachi Health Center, a youth-friendly service, has been enhanced through material support and training for the health service providers. For example, youth-friendly services in government health centers are strengthened through the trainings and provisions of medical and non-medical equipment, such as ultrasound, examination beds, and computers to improve access to youth-friendly services on SRH. This ensures that young people receive tailored, quality, and accessible SRH services and information that meet their unique needs.
The DSW partnership has fundamentally transformed our youth center. The provision of essential staff training and vital equipment such as an ultrasound machine and computers has dramatically enhanced the quality and efficiency of our services. This upgrade has been particularly impactful in improving access to healthcare for adolescents and young pregnant women. This collaboration ensures timely diagnosis and referrals, facilitated by the provision of essential reagents to both our health centers and nearby health posts. The improved access to resource has directly resulted in more efficient and accessible healthcare, leading to significantly better outcomes for our patients. The positive impact of the DSW partnership is evident in several key areas. We've witnessed a substantial increase in both prenatal and postnatal care, a marked decrease in mortality rates, and a significant expansion of family planning services. These improvements demonstrate the effectiveness of the enhanced resource and training provided. Our youth outreach programs have also experienced remarkable growth and success. We now reach a significantly larger number of young people, particularly those in rural areas, providing them with crucial health information and support in a welcoming and accessible environment. This initiative not only improves health outcomes, but also empowers young people to make informed choices, protecting them from risky behaviors. Future collaboration with other stakeholders will further amplify our positive impact, ensuring a healthier community for all.
ኮርነሪ ሰነ ከዘት ከነማ
እዚህ ዩዝ ፍሬንድሊ ሰርቪስ ላይ ነው ሰራው ባላማንን ቢኤስሲ ነርስ.
At the youth-friendly center within our health station, I work as a nurse. We offer a comprehensive range of services, including family planning, counseling, antenatal care, and postnatal care. Furthermore, we provide crucial counseling addressing gender-based violence, harmful traditional practices, and mental health concerns. The services offered at our center have yielded remarkable improvements, particularly since we received valuable training from DSW through SAFA. We've witnessed numerous young people overcome addiction thanks to the professional counseling provided. Overall, we've observed significant positive behavioral changes among young people at the center, especially following the DSW training.
አልትራሳውንድ ሰርቪስ ነው የምሰጠው አርኤምኤንኤች ላይ ማለት ነው።
Before assuming my current role, I worked as an MCH focal person and quality document specialist. Prior to the introduction of ultrasound services here, the community faced numerous challenges. One significant issue was the need to travel long distances to Delhi for ultrasound examinations. This resulted in considerable inconvenience, financial burden, and disruption to daily lives. Additionally, the quality and frequency of ultrasound services in Delhi were suboptimal. The launch of ultrasound services at our facility has significantly benefited the community. We've identified and addressed various pregnancy-related complications, such as hygiene-related issues and other health problems. Overall, the availability of ultrasound services has greatly improved the health outcomes of pregnant women in our community. It has not only simplified the lives of residents, but has also enhanced our professional capabilities. I would like to express my sincere gratitude to the project for providing the ultrasound equipment and supporting its full operation. This initiative has effectively addressed many of the challenges we previously faced.
ወይ ሳፋ ፕሮጀክት ደግሞ በጣም አፕሪሺየት ሊደረግኝ ብለው ብዙ አይነት አልትራሳውንዶች አሉ። ይሄ ስልጠና ከተሰጠ ኦፒዲ ላይ ለራሱ የሚታዩ ነገሮች አሁን ታይሮይድ ፋክሽን መስራት ይቻላል።
የሮን ኦልፋሱሬ አስቂጥፈኒ ላላማትራ ተራሳውንዲ አቺ ጋፋና ተራሳውንዲ ሰና ኢላላሞ ሙጫንጌ ጉዳና አንጀኒ ተወኒ.
When I was pregnant, health professionals checked me through ultrasound. They told me that my infant was bigger than normal size, so that I couldn't give birth naturally through labor. Then they referred me to Delhi Hospital. Similarly, health professionals in the hospital checked me through ultrasound and assured me that my infant was bigger than normal. Then they made me give birth through surgery. Hadn't they checked me through ultrasound, they wouldn't have known the condition of my infant. If I was not checked through ultrasound, I couldn't deliver a healthy child and be safe myself. So I am very benefited from the ultrasound service. I am very healthy now. If I didn't come here and checked through ultrasound, I would be in trouble. Therefore, I advise women to come and be checked through ultrasound. This can help not only their health, but also their baby.
fakkeenyaaf qusannoo maatii opereeshinii awwaanindeef furachuun qaba isa faafudheera.
Walif Youth Empowerment Center is one of the facilities that received material support such as computers, office furniture, and comprehensive training on sexual and reproductive health SRH, gender-based violence GBV case management, and other culturally sensitive issues that are often difficult to discuss openly. Furthermore, the youth from the center received training on psychosocial support and counseling service, club leadership and management, basic financial management, and entrepreneurship and business skill from the project. These upgrades created a safe and welcoming environment for young people to access vital resources, information, and a space for peer-to-peer discussions. Moreover, after being empowered, the youth were equipped with audio materials for engaging in edutainment activities, both in and out of school settings, where they advocate within the community on youth SRH issues, including taboo topics.
My volunteer work has dramatically boosted my confidence, enabling me to overcome my fear of public speaking and effectively teach large groups. Despite joining late, I receive excellent training covering life skills, reproductive health, and abortion. While teaching youth has been incredibly rewarding, the work faces significant challenges: community resistance, particularly rooted in religious objection to contraception, hinders door-to-door education efforts. This society of resistance underscores the need for open dialogue, a shift from the current taboo surrounding these topics. Our organization's success, including members overcoming addiction to contribute, highlights the potential of expanding similar initiatives focused on personal growth and community impact. Nationwide programs prioritize human well-being, and educating high schoolers on reproductive health would be transformative, empowering young people and reflecting my own deep commitment to service.
Another innovative approach addresses menstrual hygiene management, a critical issue causing many girls and young women to miss school and other socio-economic activities. The SAFA project trained young women in the Youth Empowerment Center to produce reusable sanitary pads, providing them with sewing machines and linking them to the local technical and vocational college for hands-on training. This initiative not only supports menstrual health, but also equips these women with economic opportunities to improve their livelihoods.
ስንጀምር መጀመሪያ ሁላችንም በአንድነት እየሰራን ይያለ 5 ሴቶች ተመርጠን ወደ ቢሾፍቱ በመሄድ ስልጠና በመውሰድ
For the past 2 years, I've served as a coordinator at this club, leading a group of young women in the production of sanitary pads. We collaborate with other youth groups, and our work began after a training program in Bishoftu facilitated by DSW. 5 of us initially participated in the training, which equipped us with the skills to design, pattern, and sew sanitary pads using sewing machines. The DSW provided all necessary materials and continues to support our ongoing efforts. We distribute the pads to students, providing instruction and raising awareness about their benefits, emphasizing their superior comfort and protection against infection and disease. The DSW support has been instrumental in establishing their initiative and empowering us to improve the health and well-being of girls in our community.
DSW Ethiopia's successful project implementation is a result of strong collaboration with various multi-sectorial stakeholders, partners, and like-minded key government stakeholders at national and subnational levels. This collaborative approach has significantly increased community awareness and understanding of sexual and reproductive health, empowering residents with vital knowledge about adolescents and youth SRH issues.
Some of the projects DSW is implementing itself alone, and some are in partnership with our other implementing partners. I would mention a Youth for Health project, one of a joint initiative between Mary Stopes and YNCD, Youth Network for Sustainable Development, and the DSW, where we are advocating to increase domestic resources for adolescent and youth sexual reproductive health, which primarily target the federal parliamentarians and regional parliamentarians, really to influence the budget allocation process that are taking place every year. Coming to the national level, we are not working alone. We are implementing with the government stakeholders and partners. We are not creating a parallel structure. We are working with the existing government structure. We work with the Ministry of Health and the regional health bureaus and its organ. We work with the Ministry of Women and Social Affairs, particularly the Youth Affairs Wing. And we also work with finance and economic development cooperation at different levels. So DSW is really not implementing by itself. We are working in collaboration with others too, to make sure that our program is sustainable and will have a long-lasting impact.
DSW በጣም እያገዘን ያለ ፕሮጀክት ነው.
Following the government's plan, We are providing efficient services, working closely with partners, especially DSW. While we have technical and logistical supports at the zonal level, occasional shortages can affect our daily work. Fortunately, DSW provides assistance when we request it. We are making services accessible at the district and Kabale levels. Peer pressure and a use-friendly approach mean young people learn from each other about reproductive health and related issues. In our zone, we have provided 2 weeks training to health staff in Badale and Gachi districts. This significantly improves their skills and efficiency. We also have strong multi-sectoral committees. Collaboration both among stakeholders and with DSW enhances our service delivery. DSW works with us for the benefit of our youth, completely free of charge. This has led to many of our young people engaging in positive activities, unlike in some other areas. Thanks to DSW support and resulting behavioral changes, premarital sex and unsafe sex leading to abortion among adolescents is rare.
ስሙዝ በሆነ ኮሚኒኬሽን ነው በቅንጅታዊ የምንሰራው። ስለዚህ ምንም ኮምፕሌን የለብንም። ቴንኪው ለማለት ፈልጋለሁ።
ፈያ ወሎርማታ ደርገጎታ አረቲ ከንኒ ሆጀቱ
This project is related to young women. It has created a favorable environment for the health of these women who are not married and who work from place to place. With regard to cornea, the project is designed for women to help them work without any fear, and the government is working on that. This also works in schools. It creates awareness and share experiences to each other. As our region, we're grateful in helping the health of mothers. It works on creating awareness for women aged 15 to 29, provides any healthcare services, and also provides advices. The impact of this project widely touches mothers and women who are being affected in our region specifically. It helps them get education and the support they need.
dhaabbata haala gaariidhaan dargaggoota sitti siqee fayyaa isaanii irratti keessumaa xiyyeeffannoo addaatiin hojjetaa jirudha jechuudha.
From SAFA project, one of the key lessons is really an integrated intervention is very important. You know, young people, they do not have only a single problem. They have different problems. You know, health might be one, and unemployment could be the other, and psychosocial problem would be another one. So such integrated interventions really address the multifaceted problems of young people. So that's really another lesson that we learned from SAFA. We were 3 different organizations implementing our own activities based on our expertise and lessons. We came together forming such consortium to address different problems of young people. So we played really a crucial role on our part, and we created synergy to address the multifaceted problems of young people. I think this is really a strategy that should be adopted to different contexts by different organizations to address different problems of young people. The last but not least, really the engaging adolescent married girls as a change agent is really very important. You know, married adolescents, they are not really participating in club activities. You might not really see them in different social groups because they are under the control of, most of the time, in-laws. So engaging adolescent married girls as a change agent and really designing a strategy on how to go home to home and reach out to different married adolescent girls and couples is really a good strategy that we can adopt really to address those married adolescent girls, particularly in the rural area. That's really a very effective strategy. I say as we are talking about the future, we might have our own plan, and we might implement if it's the will of God. So I think we have critical key issues upcoming as a key challenges of young people. The first one is we want to really integrate peace component, you know, on how to coexist among young people. We want to engage our youth champions, not only as a champion for adolescent and sexual reproductive health, but to become a champion for peace promotion as well. So we want them to be a peace ambassador. We want to train our facilitators on how to promote positive coexistence among the communities, among their peers, because young people, particularly youth, are the victim, and they are also the one who has been engaging in different activities. So we want our integrate peace component in our activities in the future. The other one is the livelihood component. There are huge demand among young people. Mainly, we had some pilot in terms of training and engaging adolescent girls in sanitary pad production and distribution. So we want to integrate and also strengthen this production and distribution to needy rural girls, because the need for sanitary pad production is really increasing from time to time. So reusable sanitary pad production and distribution will be strengthened in the upcoming project period.